When you call 911, dispatchers send police, fire, or EMS to help. And in Minnesota, there is a fourth option. Dispatchers are required by law to refer mental health calls to trained mental health professionals.
Last year, 5 Investigates uncovered that wasn't happening in some parts of the state. But investigative reporter Kirsten Swanson now has new data showing that response is improving.
Our initial reporting found that these 9 counties didn't refer a single 911 call to mental health crisis teams after the law was passed. New state data now shows only these 2 counties still hadn't referred a call in the last 2 years. But what surprised us most is what we saw in Dakota County. Law enforcement there have referred hundreds of 911 calls since the law took effect. So we went to find out why and discovered a system that many point to as the model for how to handle alternative response. A warning, this story references acts of self-harm.
You're all right, bud.
Mike Taggett is most comfortable with his dog Rosie by his side.
She's the reason I'm still here.
It's her presence that gets him through the day and that got him through one of the worst days of his life 9 months ago.
I got way behind and there was just no way to get caught up. And I could see no way out.
Mike attempted suicide in the midst of harming himself, battling voices in his head.
One of the other voices is like, we need help. And somehow called 911.
First responders rushed to his South St. Paul home to take him to the hospital.
There was a lot of officers and I think there was some mental health workers as well.
That co-response is a model Angela Lockhart is responsible for introducing in Dakota County. As social services coordinator, she oversees a team that works with law enforcement on mental health calls.
People who are really struggling are going to continue to struggle without intervention.
In 2021, the county was forced to confront an evolution in that response. The legislature passed Travis's law that year, requiring 911 dispatchers across the state to include a referral to mental health crisis teams where available.
There's trepidation, definitely.
Brent Anderson is operations director at Dakota County 911.
All of a sudden it was passed and we realized that, all right, things have to change here for us in a hurry.
Anderson and Lockhart worked alongside others in the county to develop a protocol.
Police and fire can help you.
Together, they decided what kind of calls dispatchers would transfer to the Crisis Response Unit, a group of trained mental health professionals who work for the county.
What are some non-negotiables where you would send law enforcement instead of mental health?
Yeah, if there was a crime that's been committed or if there's weapons involved, absolutely law enforcement goes.
Weapons is a big one.
James Mitchell is a dispatcher.
You know, if they're just sitting there and have a gun with an easy access or something, you know, we're not going to just transfer them to crisis and call it good.
It might turn into a situation where a true co-response is the better response option.
But Lockhart says she believes the county's protocol is following the intent of the law. In 2023, dispatch transferred almost 1,000 911 calls to the Crisis Response Unit. Last year, that number rose to nearly 1,400.
83% of those calls were able to be handled by the Crisis Response Unit without the involvement of law enforcement.
That's 83% of calls that don't need to have a law enforcement. A cop does not need to go out there. That's significant.
Why do you think it works?
I think because we've had such good open communication, we talk things through. I think that's the foundation of why things are working is because we are willing to work together all for the common goal.
The goal, helping people like Mike. During his stay at the hospital, he got a call from a crisis worker asking about Rosie.
She came back because she knew I had a dog and she was worried about the dog being taken care of.
The crisis team reunited the pair, helped Mike find housing, and got him into therapy.
Crisis response is important to bridge the emergency care with the long term. I really wish I didn't have to attempt suicide to find out that there was help.
There are other ways local governments are working to comply with the law. Recently, both the city of Minneapolis and Washington County approved funding for an embedded social worker who will be in the dispatch center. That person will help screen 911 calls and then transfer them to the appropriate crisis response teams.
Do we have an idea of how many calls total are being transferred across the state?
Well, we do know from DHS data that last year there were at least 2,100 calls referred by law enforcement to mental health teams. That was in 2023 and 2024, but those numbers actually don't tell us the whole story because every county handles mental health calls differently. So Dakota County uses in-house workers from their social services teams. Others, mostly rural counties, often contract with third-party providers.
So who's responsible for making sure the law is followed?
Yeah, at this point, no one. There is no state agency or oversight body watching for compliance on this. It's another reason that we don't have good data on it. Last year, Representative Jessica Hansen introduced a bill prompted by our investigation that would require more oversight. It didn't go anywhere last year, but it was recently reintroduced, and we're going to be watching closely as it progresses.
That was a powerful firsthand story.
Yeah.
Yeah, and we need to spread the word about this because, as Mike said, you shouldn't have to attempt suicide to find out the help is available.
Absolutely. And there are resources available too. If you or anyone you know are struggling with mental health, please reach out. 988 is the crisis line.
Thanks, Kirsten.
Kirsten, thank you.